Hello there, welcome to another amazing episode of Kids and Mom. I am your host and my name is Yele. On today's show, it promises to be educative, informative and enlightening. So what I want you to do is stay right there and we will be right back with more for Kids and Mom. Welcome back. On today's show, we will be talking about oral health for children. And I have with me today Dr Remilekun Williams. She is a consultant dental surgeon and medical director of Faces and Braces Dental Clinics. She holds a Bachelor of Dental Surgery from the prestigious University of Ibadan in 1985, and she became a consultant in 1998 from the Postgraduate Medical and Dental College, Lagos, with specialization in orthodontics. She is a member of the Nigerian Medical and Dental Council, Nigerian Association of Orthodontics, American Association of Orthodontics, Lingual Orthodontics, World Federation of Orthodontics, and an associate member of WIMBIZ. Welcome to Kids and Mom, Dr. Remilekun Williams. How are you doing today? Good. It's so good to have you on the show. We have so many things to talk about, and we're just going to go right into it. So my very first question to you is, what made you decide to be a dental surgeon?
I would say it was divine.
Okay.
I actually wanted to be a nurse, but my father insisted I had to be a doctor.
Oh.
To cut the long story short, I ended up in the dental clinic because I had a bad toothache at the age of 18.
Okay.
I was overwhelmed by the size of the equipment, the compassion of the dentist, and that actually geared me into dentistry.
Oh, wow.
I had done JAM and I put in for medicine.
Okay.
However, I fell short of the cutoff point, and that's how I ended up in dentistry.
Also, it was truly divine. Okay, perfect. All right, so my first question to you is, at what age can a child develop dental issues?
Usually this will be from about 6 months when the baby teeth begin to erupt.
Okay.
It may be associated with a fever. The child may be complaining or irritable,
Okay.
rubbing on the gums. So usually it will start about then, during eruption of the teeth. However, main dental problems may not begin till after age 1, depending on the diet of the child as well.
Okay, so speaking about diets for children in dental care, what are the precautions or things that moms should avoid for their children so as not to have dental issues?
Because they're children, you can't stop them from eating things that are sweet.
Yes.
However, we also encourage mothers to feed them with foods that are healthy.
Okay.
Okay? Because the essence is because dental problems usually will start with children. Common dental problems are cavities.
Okay.
And these cavities are as a result of eating sugary foods
Okay.
that get stuck in between the teeth or are left on the teeth because of improper oral hygiene.
I want to ask you a question about how mothers who are preparing to give birth, what kind of information and education do they need now about dental hygiene for their kids?
Usually we like to inform mothers who are pregnant,
Okay.
particularly during the antenatal classes, on what best to use once the teeth begin to erupt. However, they should also have the information that fevers during pregnancies can actually affect the permanent teeth of the child. They also need information on the types of medications that the child will take, because medications can affect eruption of permanent teeth. Okay. Usually other information will be what the child will eat as well. It's always nice to give them fruits and vegetables rather than sugary fruits, and of course plenty of water.
Okay.
Oral care in children is very essential. Oral care in children needs to be monitored. Like we've been told, children should brush twice daily, both in the morning and in the night. it is very key, because if you don't do that, really, it tends to give children a lot of cavities. And I guess mom especially should be aware of this fact, and they should guide the children along.
It's also the same way with an adult. You change your toothbrush, especially maybe after 3 months, one, or if you notice that the bristles of the brush have already started flaring around or it's no longer straight, then you can change the brush. If you notice any discoloration on the brush, you can change it. No matter even if it's 2 days or 3 days, please change the brush when you notice any change on that brush.
Drop your comments and questions on our Facebook page. You can follow us on Twitter and on Instagram. So I want to ask another question. At what age or what time when the baby is born should the parents start cleaning the teeth for the child?
Usually, because the teeth erupt at about 6 months, the first set of teeth.
Yes.
And usually the lower ones come out first.
Yes.
Usually we would advise that at that point they use a soft cloth and a cotton wool, or a cotton wool, a glycerin. Before age 2, we would use a toothbrush, either extra soft or medium. It does graduate as the child gets older.
Okay.
But more importantly, before the age of 3,
Yes.
it's mandatory that a toothbrush and a fluoride-containing toothpaste is used for a growing child.
Now, when we're talking about fluorides, are all toothpaste out there fluoride, contains fluoride that is healthy for the teeth for the child?
Ideally, we must take fluoride, or children must take fluoride till about age 60. And that's because fluoride hardens the enamel of the tooth.
Okay.
And also helps to remineralize teeth that have been broken down
Okay.
as a result of acids from sugary foods.
Okay.
And because fluoride is a cavity-fighting mineral, you'd want mothers to have fluoride in either the water or topical or systemic, which is either in water. Unless you're in an area where there is no water, fluoridated water, then the dentist would advise on how to put fluorides like tablets, rinses. But it's important that the child uses a fluoride-containing toothpaste.
Okay, so I wanted to ask about how often should the toothbrush that we use, because obviously all of this is associated with use. How often should the toothbrush for the child and even for the mom be changed?
It's recommended that toothbrushes should be changed every 3 to 4 months, or when the bristles become frayed or dull. The reason being that toothbrushes that are dull or frayed become brittle and they are not effective in removing plaque or food debris that are left in the mouth.
Oh, great. Okay, so let's talk about how to use the toothbrush for the kids, okay? I know that you have some equipment here that is going to help us, and I know that you're going to demonstrate for us the proper way to brush our teeth. And I want the children watching and the moms watching the show to look at the demonstration that Dr. Remilekun is going to give us about the proper and the most effective way to have the teeth brushed, and how the moms can teach their children on how to brush their teeth going forward. So, Dr. Remilekun, could you pick up the teeth? This is a very big teeth, kids. Can you see how big it is? All right, so can you teach us, just show us exactly what to do?
It is very important that the soft toothbrush is used.
Okay.
For children aged 2 to 3, I would advise that you use the size of a rice grain, the amount of toothpaste. However, from about age 3 onwards, pea-sized amount of toothpaste is required. Now, once the toothpaste is on the brush, the mouth must be opened first.
Not closed?
Not closed.
Okay.
Most times we will close the mouth brush. The mouth must be opened, and the toothbrush is placed at an angle against the gum and the teeth in a downward position. And you brush in strokes, as you can see.
Circular strokes?
Circular strokes, yes.
Okay.
From the gums downwards for the upper teeth, and for the gums upwards.
For the lower
For
teeth.
the lower teeth.
Okay.
And this is advised, both children and adults. This is the way to brush. Following that, you brush the surfaces of the teeth and also the inside of the teeth.
Okay.
Okay. This is a basic technique, just like the rotatory electric toothbrush.
Yes.
That's actually the principle on how it works.
Okay.
Brushing shouldn't be more than 2 minutes.
Not more than 2
Not
minutes.
more than 2 minutes. About 30 seconds for 1 minute.
Okay. Now, what about the tongue? Are we supposed to brush the tongue every time?
Child must not forget to brush the tongue.
Okay.
Supervision is actually key with little children for parents to monitor how the children brush their teeth.
Okay.
Most times the children always want to brush the teeth very early, but their manual dexterity doesn't give room for that yet.
Okay.
Okay, so usually you would leave a child maybe by about age 7, 8 to brush on their own. But before then, supervision is key.
Okay, so when they get to ages 7,
8.
and when ages 8, then they can be without supervision. Moms, can you hear that? You have to supervise your children brushing their teeth up until the age of 8. Thank you so much.
The fact that different teeth come out in different times, 1. 2 is that at this stage, they are at the stage whereby they are prone to a lot of dirt. Why? Because they neglect their mouth, unlike an adult who is always cautious about what he eats, how he brushes. But they are kids, they take a lot of sweets and they neglect cleaning their mouth. So we always like to target the kids first, which will help them to grow with the right attitude towards cleaning their mouth as an adult. Parents, please always ensure that you monitor the brushing of your children, no matter the age it may be. Don't leave them to brush. What I advise is while they brush in the morning, you just watch how they brush, or you brush with them so they see how you brush. And at night also, you also advocate brushing at night, because if you miss the brushing at night, then you have neglected one part of the cleanliness.
Dentists recommend twice daily, so in the morning and late at night, just to take out the germs and take the plaque and all those things after eating. So I think I would go with the dentist's recommendation because they're specialists.
Drop your comments and questions on our Facebook page. You can follow us on Twitter and on Instagram. Let's talk about bad breath. Now, it's a very embarrassing situation when a child develops bad breath. What are the root causes for bad breath, and what can mothers do to either prevent it from happening or alleviate the source of the problem?
Most commonly, cause of bad breath is improper oral hygiene. And what I mean by that is not brushing correctly, or not brushing twice a day, or not brushing with the correct toothbrush or toothpaste. Okay, so most of the time it's usually improper oral hygiene for children.
Mm-hmm.
It could also be other forms of illnesses.
Mm.
Also, it could be as a result of diseases in the mouth, cavities that are formed and haven't been taken care of, food stuck in between the teeth and haven't been brushed off. Okay, so those things can cause bad breath. Also, medications, certain foods that we may eat may have an impact on the freshness of breath, not necessarily causing bad breath, but it's also important that as well the mouth is not dry. And so in children that are mouth breathers, that's also an indication for plaque accumulation and also bad breath.
Okay, so what can mothers do to control the situation if their child already has it? Or what information and education do mothers need to have, especially the antenatal mothers preparing for the birth of their children? What do they need to do to make sure that it doesn't happen?
Okay, like I said, supervision is key, especially little children, that the mother monitors and actually does the brushing themselves to actually get the teeth clean. Also, food, the diet that the child eats, very important. Good nutrition healthy foods, avoiding sugary stuff all the time. Because some have the habits of having this sugary stuff daily. And usually we like to advise it rather than give them sugary foods all the time. Because this breaks down to form acids and then plaque. And that is actually most commonly cause of bad breath. So we advise apple slices, carrots, cucumber, vegetables and fruits are a healthy form of maintaining oral hygiene, good oral hygiene.
Okay, so babies that use the bottle to feed and they use the bottle at night to feed, are there any complications about the teeth that parents need to be aware of?
There are risks in doing that. For children that are prone to sugary drinks, particularly at night, they stand a chance of developing what we call rampant caries. That's cavities that just develop on almost all the teeth. That is because they've left sugar on the teeth all night, and it just gives bacteria a lot of time to work on the teeth, and the teeth just break down. Those who are predisposed to this, you will see them develop what we call rampant caries, and that is just cavities in almost all the teeth.
Oh, wow.
For each eye.
Okay, so any last words or education or information that we need to pass across to our parents, especially the moms?
It's also important that moms form good oral habits. If moms have very strong oral habits, they will also pass that same information and strength and zeal to brush their children's teeth twice daily, using the correct toothbrush, the correct ambulation of brushing, fluoride-containing toothpaste, and brushing day and night is critical for good oral hygiene.
Amazing. Thank you so much, Dr. Remilekun. It's been an amazing and very interesting conversation. All right, we will be right back on Kids and Mom with more tips, more activities, more information, more education. Don't go anywhere.
Hello, my name is Nichole Genge. I'm 7 years. I'm in primary 3. My best color is violet. My favorite food is spaghetti, and my favorite subject is maths. I like to be a doctor because I want to save people's life. My mom, because sometimes she tells me what to do to be a doctor. I love swimming, playing, and dancing.
My name is Adetola Ogbebo. Thank you for watching Kids and Mom.
My name is Esosa Adelaja, and keep watching Kids and Mom. Thank you.
Hi, my name is Omomi Olunloyo. Welcome to the Kids Care segment. Today I'll be sharing with you 6 tips to make you the best mom ever to your child. Number 1, who are you? As a mom, you need to know who you are, because when you know who you are, it helps you to be able to be a better mom to your child. Who you are is kind of like a cliche kind of sentence. When people say, who are you? Say, my name is Omomi. But actually, there's more to Omomi. Omomi is different. Omomi is unique. Omomi is special. And in that respect, you need to do that with your child as well. You need to see your child as different, as special, as unique. Try not to compare your child with anyone, because like I said, your child is different. Even the twins who are born on the same day, they are different in terms of the way they carry themselves, in terms of the way they behave. So knowing that will help you to be a better mom to your child. You need to know your child's ability. What are they good at? What sports, what activities, what things do they do that they shine? You help them, you encourage them to be that person that they are born to be. And knowing who you are will help you to do that with your child. It's also important to instill discipline. When you are disciplined in terms of what you do, in terms of waking up in the morning, how you eat, you understand your feeding pattern, what you wear, homework duties, for example. Your child comes back from school. What is the first thing they do when they come back? Do they wash their hands? Do they have lunch? Do they remove their clothes? Do they fold their clothes neatly? All this will help in terms of instilling discipline to your child. Who you are is a very key factor, because Who you are will help you to be the best you can be the best version of yourself. And what is the best version of yourself? That is who you've been created to be. And who have you been created to be? How do you know that? You look at yourself and you think to yourself, what do I do? What can I do? What can I offer? Knowing all of that will help you to be able to instill that to your child. It will be able to help you to become the best mom you can be for your child. The last tip will be to let your child express themselves. So I'll tell you how that can happen. So your child watches a movie, for example, and does not understand what they're watching, and they're asking you questions. Give them the opportunity, give them the audience, listen to what they have to say. Or perhaps they saw something, or they read something, or perhaps they're even angry at that point in time. Give them the opportunity to express themselves, because doing this will let you and the child know who they are. So just to recap my 4 tips on who you are as a mom that will help you be the best mom ever to your child. Number 1, know that your child is different, unique, and special. Number 2, do not compare your child with any other child. Number 3, know that your child is not in competition with anyone else. And lastly, give your child the opportunity to express themselves so that they can be the best version of themselves. Thank you for listening. Bye.
Thank you so much for tuning to today's show. I'm sure you've learned so many things about oral health, including the fact that babies' teeth are always white and adult teeth are not. Until we come your way again, same time, same station. Thank you, and we will see you again.